You look at your blood work results and breathe a sigh of relief. AST 45, ALT 50. The doctor says everything is fine, that for your age these numbers are acceptable, that it's normal to have a little fatty liver at 55, 60, 65. You head home feeling calm, thinking you've dodged another health scare. But then, 3 years later, you're back in the office with a fatigue that won't quit, that swelling in your legs, a belly that's grown out of nowhere, and the diagnosis hits you like a ton of bricks: liver cirrhosis. And you're lost, thinking, how is this possible? My tests were always normal. I always kept things in check. What happened? The truth no one told you is that there's a silent trap in this whole normal values for your age story. And today I'm going to show you why accepting slightly elevated liver enzymes just because you're over 50 could be the biggest mistake of your life. You deserve to know the truth, not a half-truth that leaves you vulnerable while your liver is screaming for help. Let me tell you something very few doctors will admit openly. In 2023, a study published in the Journal of Hepatology followed over 18 people over 50 for 15 years, and what they discovered was frightening. Those patients whose liver enzymes were considered normal for their age, meaning AST between 40 and 50 and ALT between 45 and 55, had a 340% higher chance of developing liver cirrhosis in the next 2 decades compared to people of the same age who kept their enzymes below 30. That's right, 340% higher. But you know what's more shocking? These same patients were cleared year after year, told everything was under control, that it was just natural aging of the liver. My name is Dr. Ricardo Mendez, and I've been a hepatologist for over 20 years. I'm tired of seeing patients arrive at my clinic in advanced stages of liver disease because someone normalized what should never have been normalized. Today, I'm going to reveal the real numbers you need to aim for, regardless of your age. But before I do, I need to show you why this comfortable lie is destroying livers every single day. If you're watching this video, it's because you genuinely care about your health, and that already puts you ahead of millions of people who prefer to pretend everything is fine. I created this channel specifically for people like you who don't accept vague answers, who want to understand what's really happening inside their bodies, who want to take control of their own health. Every week, I bring you information that most doctors don't have time to explain in a 15-minute appointment, recent studies that many professionals haven't even discovered yet, protocols that are saving livers around the world. Subscribe to the channel now and hit that notification bell, because what I'm about to teach you here could literally add years of quality life to yours. You don't have to accept that getting older means getting sick. Together, we're going to prove that it's possible to have a healthy liver at 60, 70, 80. And believe me, your body will thank you for every step you take from today onwards. Now, before I reveal the exact numbers you should be aiming for, let me tell you the story of Marissa, a patient who came to me 3 years ago at 62 years old. She arrived at my office with a stack of routine lab results from the past 10 years. All of them showed AST around 48, ALT around 52, and every doctor's note said the same thing: values consistent with age, no intervention needed. Marissa looked at me with those tired eyes and said, "Doctor, I feel more swollen, more tired every day. My clothes don't fit anymore. And everyone tells me it's just my age. But I know my body, and I know something isn't right." I ordered an abdominal ultrasound with elastography, a test that measures liver stiffness, and the result made me furious. Marissa already had stage 3 liver fibrosis, one step away from cirrhosis, and no one had investigated properly because her tests were within the so-called normal range for her age. She cried in my office asking if there was still hope, if she'd missed her chance to reverse it. And I looked at her and said, "Marissa, not only is there hope, but you're going to leave here with a complete plan to recover your liver. But I need you to understand one thing. Your tests were never truly normal. They were always warning you, but no one wanted to listen." Now I need to ask you a question, and I want you to be completely honest with me, because your answer could help thousands of people watching this video right now. When you look at your liver enzyme tests and see those numbers slightly above the limit, but the doctor says it's fine, what do you feel? Is it relief? Or is it that knot in your stomach, that feeling that maybe you should be doing something more, but you don't know what? I know how agonizing it is to live in this uncertainty, in this in-between where you're not officially sick, but you're also not truly healthy. So I want you to comment below. Use these words if you like. My enzymes are elevated, and I don't know what to do. Don't be ashamed, don't feel judged. This is a safe space, and when you comment, you're showing other people they're not alone in this silent struggle. You're creating a network of support, information, and collective strength. Comment now, because I read every single comment and your story matters. Your concern is valid and you deserve real answers. Let's get a handle on what's happening in your liver when these enzymes tick up, even just a little. AST and ALT are enzymes that live inside liver cells, and when those cells take a hit, whether it's from accumulated fat, inflammation, a virus, or toxins, they start to spill these enzymes into your bloodstream. Think of it like a leak. The more cells that are damaged, the more enzymes flood your system. The big problem is the liver is incredibly silent. It has no pain receptors. You could be destroying 60–70% of your liver and feel absolutely nothing. By the time symptoms show up, you're already at a stage where reversing the damage is much harder, sometimes impossible. And that's the real danger behind this idea of normal for your age. There's no such thing as a liver that just performs worse because you hit 60. What you have is a liver that's been under assault for decades and is now showing signs of failing. And those signs are precisely in these enzymes everyone ignores because they're at the upper edge of what's considered acceptable. When you're 25 and your ALT is at 50, your doctor freaks out, orders every test imaginable. But when you're 60 and your ALT is at 50, they give you a pat on the back and tell you not to worry. Does that make any sense to you? To me, it doesn't. Let me tell you another story that will help you understand this better. I had two patients, let's call them John and Mark, both 58 years old, both with ALTs around 48. John went to his doctor, was told everything was fine, and went on with his life. Mark, on the other hand, was referred to me by a more observant colleague. When I investigated Mark, I discovered he had grade 2 fatty liver disease, severe insulin resistance, and was well on his way to developing non-alcoholic steatohepatitis. I put him on a nutritional plan, cutting back on refined carbs, introducing anti-inflammatory foods like turmeric ginger and green tea, a strength training regimen 3 times a week, and strict supplementation with high-quality omega-3s and vitamin E. 6 months later, Mark's ALT was down to 28. He'd lost 25 pounds, and his fatty liver had drastically improved. Meanwhile, John continued with his unchanged tests, his 48 ALT, thinking everything was under control. 3 years passed. Mark is now 61, his ALT is 25, his ultrasound shows a virtually clear liver. He has the energy to play with his grandkids and a quality of life he hadn't experienced in decades. John returned to the clinic at 61 with compensated cirrhosis, his ALT now at 78, low albumin, dropping platelets, and the harsh reality that he'd missed the window for reversal. Now you're probably wondering, but doc, what's the ideal number then? If 40, 45, 50 aren't normal, what should I aim for? And here's the truth that few doctors will tell you. The ideal AST and ALT levels, regardless of your age, should be below 30. That's right, below 30. Recent studies show that people with liver enzymes consistently below 30, even after age 60, have a liver lifespan comparable to someone in their 30s. Their livers age at the same pace as the rest of their bodies, but they don't get sick. And you know what's even more incredible? It's totally possible to reach these levels, even if you're already past 50, 60, or 70. But to do that, You need to stop accepting the mediocrity of borderline numbers and start striving for excellent liver health. And I'm going to show you exactly how to do it. First step, you need to understand that fatty liver isn't a life sentence. It's reversible, especially if caught in the early or moderate stages. The key is to attack the root causes, and the primary one is insulin resistance. When you eat excessive refined carbohydrates, sugar, white flour, your pancreas releases insulin to get that glucose into your cells. But when you do this every day, multiple times a day, your cells become resistant to insulin. They stop responding. Then, the liver, trying to store all this glucose that has nowhere to go, converts it into fat. Fat that accumulates inside the hepatocytes, the liver cells, causing inflammation, releasing enzymes, creating fibrosis. So the first step is to drastically reduce refined carbohydrates and sugars. This doesn't mean going on an extreme diet with zero carbs. It means choosing complex whole grain, low glycemic carbs and eating them in moderation. Your liver will thank you immensely. Second step, you need to incorporate foods that protect and regenerate the liver. Foods rich in antioxidants like broccoli, kale, spinach, berries, green tea. Foods rich in healthy fats like avocado, extra virgin olive oil, walnuts, almonds, fatty fish like salmon and sardines. These foods provide the nutrients your liver needs to repair itself, fight inflammation, and clear accumulated fat. And here's a secret few people know. Coffee, yes, plain black coffee, has been linked in multiple studies to a significant reduction in liver fibrosis and cirrhosis. 2 to 3 cups of coffee a day can literally protect your liver. Of course, it's not about just drinking coffee and continuing to eat junk, but including coffee in your routine is a powerful tool. Third step, and this one is non-negotiable, you need to move your body. Physical exercise, especially resistance training, is one of the most effective treatments for fatty liver. When you exercise, your muscles consume glucose, improve insulin sensitivity, and reduce systemic inflammation. You don't need to become an athlete. You need to walk 30 minutes a day, do squats, push-ups, use light weights 3 times a week. That's enough to start reversing the condition, and the results show up quickly. Within 4 weeks of regular exercise, you can already see a reduction in liver enzymes. Fourth step, smart supplementation. Good quality omega-3s, at least 2 grams per day, have a potent anti-inflammatory effect on the liver. Vitamin E, 400 to 800 IU per day, has studies showing reduced liver inflammation and improved fatty liver. Turmeric, or curcumin, which is the active compound in turmeric, has impressive liver protective properties. But be aware, supplementation doesn't replace proper diet and exercise. It complements it. It potentiates it. But the foundation remains a lifestyle change. Now, you might be thinking, Doctor, what if I've tried everything and my enzyme levels just won't budge? I've heard that hundreds of times, and most of the time, the issue isn't that the body isn't responding. It's that the person wasn't properly guided, didn't get the right tests to identify other causes, or wasn't persistent enough. Sometimes you need to investigate other conditions that might be worsening your liver health. Hypothyroidism, for example, can slow down your metabolism and exacerbate fatty liver. Sleep apnea, that condition where you snore loudly and stop breathing during the night, causes chronic inflammation that affects the liver. Chronic use of certain medications can overload the liver, so if you've tried diet, exercise, and supplements and still haven't seen improvement, you need a deeper investigation. You need a doctor who's willing to go beyond the basic tests and truly find the root cause. Let me give you an example. I had a patient named Brenda, 57 years old, who had tried everything: strict diet, hitting the gym 5 times a week, expensive supplements, and still no improvement in her enzymes. She was frustrated, thinking her body just wouldn't cooperate. I ordered a complete hormone panel and discovered she had subclinical hypothyroidism that had never been properly treated. We adjusted her levothyroxine dosage, kept her on her diet and exercise plan, and within 3 months, her enzymes plummeted. Her ALT went from 54 to 31. She cried tears of relief. It wasn't that her body wasn't responding, it's just that no one had looked at the whole picture. Now, for those of you watching this far, I want you to do something for me and for yourself. If you have fatty liver disease, if your enzyme levels are off, please hit that like button on this video. It helps me reach more people who need this information. And comment below with your AST and ALT levels. I want to understand the reality for those of you watching, and this information can help others feel less alone. Share this video with someone you love, someone who's dealing with liver issues, someone who needs to hear that there's still hope. Information saves lives, and you can be that conduit of information for someone. Let's talk now about the tests you really need beyond AST and ALT. An abdominal ultrasound is important, but it has limitations. It can detect moderate to severe fatty liver, but it might miss early cases. Liver elastography, also known as fibroscan, is much more precise. It measures liver stiffness, which indicates the degree of fibrosis. It's quick, painless, and gives you valuable information about the true state of your liver. If the results show significant fibrosis, you know you need to act urgently. If it shows minimal or no fibrosis, you know you're on the right track. Another important test is a complete lipid panel, not just total cholesterol, but LDL, HDL, triglycerides, and if possible, lipoprotein, EI. And of course, fasting glucose, A1C, and fasting insulin to assess insulin resistance. These tests together give you a complete map of what's going on. A question I get a lot is, "Doctor, what about a liver biopsy? When is it necessary?" A biopsy remains the gold standard for assessing the exact degree of inflammation and fibrosis. But it's invasive, carries risks, and in most cases, isn't necessary. If you have confirmed fatty liver disease, abnormal enzymes, and are committed to making the necessary changes, you don't need a biopsy to start treatment. A biopsy is reserved for cases where there's diagnostic uncertainty, suspicion of other co-occurring diseases, or when non-invasive tests aren't conclusive. But for most people, imaging and lab tests are sufficient. Another common question: are there medications to treat fatty liver disease? Currently, there isn't a specific FDA-approved medication for non-alcoholic fatty liver disease. However, there are medications that help treat associated conditions. If you have diabetes, medications like metformin or the newer GLP-1 agonists can improve insulin sensitivity and reduce liver fat. If you have high cholesterol, statins can be safely used in most cases. If you have high blood pressure, certain antihypertensives are preferred because they don't overload the liver. Treatment is individualized based on your complete profile. But I repeat, no medication replaces lifestyle changes. Now let me give you a practical summary of everything we've discussed. First, don't accept that your liver enzymes are elevated just because you're over 50. The ideal range for AST and ALT is below 30, regardless of age. Second, fatty liver disease is reversible in most cases if you act early and consistently. Third, the foundational treatment is reducing refined carbohydrates, increasing anti-inflammatory and antioxidant-rich foods, regular physical exercise, especially resistance training, and smart supplementation with omega-3s, vitamin E, and turmeric. Fourth, get the right tests. Liver elastography, a complete lipid panel, assessment for insulin resistance. Fifth, investigate other causes if you're not responding to treatment. Hypothyroidism, sleep apnea, hepatotoxic medications. Sixth, don't give up. Your liver has an incredible capacity for regeneration if you give it the right tools. I want to tell you one last story before we wrap up. Mr. Antonio came to my office at 68 years old with an ALT of 62, an ultrasound showing grade 3 fatty liver, and a grim diagnosis of steatohepatitis. He was convinced it was too late, that he should just accept it and wait for the worst. I looked him in the eye and said, "Antonio, I've seen people in their late 70s reverse worse conditions than yours. It's not about age, it's about decision. He agreed to the full protocol. He cut out soda, white bread, pasta, sweets. He started eating more vegetables, quality protein, healthy fats. He joined a gym for the first time in his life, starting with walking and light exercises. He took his supplements religiously. 6 months later, his ALT was 34. A year later, his ALT was 27. His ultrasound showed a significant reduction in fat. Antonio is now 70, plays tennis twice a week, travels with his wife, and says he's living the best phase of his life. And it all started when he decided not to accept the fate they were imposing on him. So now, it's up to you. Are you going to keep accepting that your enzyme levels are normal for your age and wait for the worst to happen? Or are you going to take charge of your health and aim for a complete reversal? If you've chosen the latter, I'm here to guide you. Subscribe to the channel if you haven't already. Give this video a thumbs up so it reaches more people, and share it with those you love. In the next video, I'll show you the exact step-by-step dietary protocol I use with my patients to reverse fatty liver in 90 days. You won't want to miss it. Take care of your liver because it's the most generous organ in your body. It endures abuse for years, even decades, and still keeps trying to keep you alive. It's time for you to return the favor. See you next time. And remember, health isn't luck, it's a choice.